Kuzuzangpola, I'm Kinley Wangmo. I work as a research officer at the Center for Bhutan and GNS Studies. As a part of our monthly research task, for the month of October, I studied the prevalence of birth defect. So it is a retrospective study with data from 2017 to 2020. I'd like to start by defining what is birth defect. Birth defects are structural changes or functional anomalies that occur during the intrauterine life, and it can be identified during pregnancy, at birth, or sometimes it may be detected later. It can be present at birth and it can affect almost any parts of the body. So it can affect how the body looks or how it works, or in some cases it can affect both. So birth defect is abnormalities of the structure or function, including metabolism, which are present from birth. A background on why I did this study. So globally, it is estimated that almost 8 million children are born with birth defects every year. So birth defect, as per the World Health Organization, is fast becoming among top causes of neonatal morbidity and mortality. But it has rarely been the focus area for public health. This is because the burden of birth defect is not known in many of the countries currently, and also there is a notion that birth defects cannot be prevented, or if it can at all be prevented, then it would require expensive and high technology interventions that are beyond the area of health budget allocations. On the contrary, there are evidence that shows that birth defects, especially those like neural tube defect and fetal alcohol syndrome, can be prevented with strategies and technologies that are not cost invasive. So determining the burden of birth defect, especially by understanding its prevalence and trend of occurrence, is critical to ensure that birth defect receives the attention it deserves as a public health priority. So with that background, there are two objectives to my study. Number one was to find out the prevalence of birth defect from data from all the birth defect sites. So 6 hospitals are currently enrolled as birth defect sites in our country. That is JDWNRH Hospital here in Thimphu, the Center Regional Referral Hospital in Gelifu, the Eastern Regional Referral Hospital in Mongar, Phuntsning, Tashigang, and Samse hospitals. Number 2 was to study the occurrence trend of birth defect. The methodology for my study is quite simple. So it is a descriptive study with data from 2017 to 20 from all the birth defect sites. So when it comes to the calculation of birth defect prevalence, it is important to include both stillbirths and abortions into birth defect, as many of the birth defect can also occur during the intrauterine life. So the surveillance system on birth defect captures all live births up to one year of age. Further, all fetal deaths for more than 28 weeks or 1,000 grams, and also all elective terminations of pregnancies related to fetal anomalies, irrespective of the gestational age, are included in the surveillance. So this study calculated the prevalence of birth defect by dividing the number of birth defects in both live births and stillbirths by total number of births per 10,000 births. So the results. So this figure shows the total births and live births that have occurred in all the 6 hospitals. So for all the 6 hospitals put together, there were 29,270 births. So out of that, 358 were stillbirths. So the total number of live births for all the 6 hospitals was 28,912. If we look at the individual hospitals, then JDWNRH recorded the highest births and Samsi recorded the lowest one. Now, if you look at the birth defect by types and by cases, so when I say birth defect by types, it includes all types of birth defects. And when I say birth defect by cases, it would mean the actual number of babies born with birth defects. So because one baby can be born with more than one defect, birth defect by type is always higher than birth defect by cases. So again, this figure shows that JDWNRH recorded the highest number of birth defect both by types and cases, followed by Mongar Hospital. Samsi recorded the lowest. So if we look at birth defect, total birth defect from all the hospitals put together, then birth defect by cases, 600 cases were recorded, and then by type, 913 types of birth defect were recorded. So birth defect by categories, again data from all the hospitals. So malformation of the circulatory system is the highest type of birth defects. This is followed by malformation and deformation of the musculoskeletal system. Then other birth defects are also consistently reported, like malformations of the eye, ear, face, malformation of the nervous system, malformation of the urinary system and genital organs. Then also malformation of the respiratory system, cleft lip and palate. So all types of birth defects have been recorded. So if we look at the prevalence of birth defect, then birth defect by cases is 204 per 10,000 births, and prevalence of birth defect by type is 311 per 10,000 births. So again, prevalence of birth defect per 10,000 births in each of the category. So malformation of the circulatory system, which stands at 124 per 10,000 births, is the highest, and this is followed by the malformation of the musculoskeletal system. So these are some of the pictures of birth defects. So on the left side, shows a baby born with a cleft foot. On the right side is a baby born with Down syndrome. Then here on the left side, baby born with cleft lip, and then on the right side is a baby born with neural tube defect. So this table shows the total of all births, total of live births, total of stillbirths, total birth defects from all the hospitals, 6 hospitals. So this shows the percent of birth defect in each of the hospitals. So we see that Tashigang is the highest with 4%, and Samtsi is the lowest with 0%. And again, this is the percentage. This table shows the percentage of stillbirths, and again Tashigang at 2% is highest, and Samtsi 0%. So if we look at the correlations, then the correlation between stillbirths and birth defect is moderate. Then correlation between live birth and birth defect is quite high, standing at 0.72, and then the correlation between months and birth defect is quite low, says minus 0.05. So some of the recommendation and also discussion. So with a prevalence rate of 387.7 per 10,000 births, birth defect is a public health concern for our country. Focus should now shift towards prevention, as well as providing early interventions for those babies already born with birth defect. The most common birth defect in our country is congenital malformation of the circulatory system, followed by malformation of the musculoskeletal system. So more studies need to be carried out to determine the causes of these kinds of birth defects so that we can start working on the prevention. Then, because birth defects like fetal alcohol syndrome and neural tube defects are also reported, these birth defects can be easily prevented by supplementation of folic acid to pregnant women, and also by creating awareness among pregnant women or those planning for pregnancy to refrain from consuming alcohol. Then medical services must also offer interventions for those babies already born with birth defect for life-saving purpose, or also to reduce the severity of disability. And then surveillance system for birth defect must be extended to hospitals that are not currently included in the system. So as of now, there are only 6 hospitals included. So if the system can include all the hospitals, then no cases of birth defect would be missed out. Then relevant programs at the Ministry of Health, like the disability program, the mother and child health program, and also the health information systems, should alert Tashigang Hospital on the high prevalence of birth defect and also stillbirth. And then relevant programs should also investigate why the percentage worked out 0 for Samtsi Hospital. So they should look at whether it is underreporting, or whether it's a missed reporting, or whether there was no birth defect in actual sense. So I would like to acknowledge the Ministry of Health and also the Southeast Asia Regional Data Coordinator, for kindly sharing data with me. And I would also like to thank Tashu Karmora for kindly helping me with the data analysis. Thank you.